Dr. Eric Glassy. Eric is a community pathologist in Southern California, a member of the Affiliated Pathologists Medical Group. Eric has chaired numerous hospital and College of American Pathologists national committees over the years and is now the governor of CAP. He's been involved with digital pathology for over 10 years, is past president of the Digital Pathology Association, and has edited and illustrated several pathology atlases and developed numerous software programs for clinical use. His talk today is entitled Opportunities and Perils, the Impact of COVID-19 on Digital Pathology.
Maurice, thank you. You can hear me fine? Okay, I'll keep going here. Greetings from California. I was hoping that what I could show you were some nice shots from around my house here. I'm now working from home, but as you've heard, California is undergoing some dramatic and climactic changes with fires. There's some raging about 70 miles north of where I am, and most of the day is the air quality here is pretty hazardous with a lot of smoke. And my son works up in San Francisco, and you can see it's orange skies for most of the day. So I'm going to talk about perils and promises of COVID-19 and how it has affected my practice. I'm a community practice pathologist, as Marie said, and I've done a lot of committee work with the College of American Pathologists and other organizations. So how has COVID-19 impacted my practice? I'll talk a little bit about some regulatory issues that have already been brought up a bit by, let's see, Dr. Fuchs, and I'll comment briefly on the impact of the future, and then finally leave with sort of a comment about the challenges that pathologists might have with social distancing. So I'm predominantly in Southern California. Our pathology group consists of 40 individuals covering 21 service centers, and we also have a private lab, and that's where I spend most of my time. The workload started dropping in February, and we experienced a 70% drop in our overall workload, much as Clinton mentioned earlier about his decrease in work volume. Fortunately, things have stabilized, and we've gone back to where now we're about 10% less than what we would expect at this time of year for our outpatient work. So March 13th is an important date. It's when, at least in the United States, the pandemic resulted in a national emergency called by President Trump. The College of American Pathologists worked hard to get congressional support